Affectionately known as the father of emergency medicine in Derbyshire, 52-year-old Manjeet Singh Riyat was the UK's first Sikh A&E consultant. He rose to become head of emergency services here. Yet despite the pressures of the role, colleagues say, he always maintained a dry sense of humour.
Inspirational, one of these people that created joy on the shop floor of the emergency department. He enjoyed the intellectual challenge. Encyclopedic knowledge of emergency medicine shaped a whole generation of junior doctors in the emergency department.
Mr. Riyat was well respected nationally, credited with contributing to the birth of academic emergency medicine, and yet he was always extremely modest about his professional achievements. His cousin told me today that the consultant was at heart a family man, married with 2 sons of whom he was fiercely proud.
He was very passionate about life. He was very kind, very generous, very warm, and anyone who met him would certainly remember him.
And he was also the first Sikh A&E consultant. You must be very proud of that.
He was very unassuming. He never wanted to talk about it, never wanted to boast about it. So he was very, very grounded.
The consultant's death means that at least 100 health and care workers have now died with coronavirus. That's according to a nursing website that's been recording fatalities since the outbreak began, a figure far higher than the 27 publicly verified by the government. A disproportionately high number have been from Black, Asian and minority ethnic backgrounds.
For the first time this week, NHS England have released data showing the ethnic breakdown of those who have died with coronavirus. It suggests that around 16% are from an ethnic background, confirming what some professionals now believe, that the impact of this crisis is not being felt equally across all communities.
Some of those who worked with Mr. Riyat say they support the government's announcement of a review into why people from ethnic minorities are disturbingly and disproportionately affected by the disease.
Losing somebody of the talents and special skills that Manjeet Riyat had is a true tragedy. He was an absolute leading light of the specialty. I think some of the backdrop to that, suggesting that there may well be a link of BAME staff having a higher mortality, does need to be urgently investigated.
Unable to meet at the Gurdwara, Mr. Riyat's family will tonight hold online prayers for him. He was a prominent member of the local Sikh community and particularly close to his extended family.
We can't support each other. The Indian community generally, when something like this happens, they rush to each other to support each other.
Mr. Riyat died at the Royal Derby, the same hospital where he had served for 2 decades. Darshna Soni, Channel 4 News.
Well, Joan Sadler is the co-chair of the NHS Equality and Diversity Council and Director of Partnerships and Equality at the NHS Confederation. She joins me now from Chingford. Obviously, all deaths from this virus are a terrible individual tragedy for families and colleagues, but there has been increasing concern about the disproportionate number of black and ethnic minority healthcare workers. You share it, I'm assuming.
Yes, I do share it, and let me first say I think it's great that we're now getting data from NHS England and improvement. We do need to work together on that data, and that shows the willing that we need to solve this problem. It's a huge, unexpected problem. It's a global pandemic, and we do need to work together with the data that we have.
I mean, that data seems to me to have been slow in coming.
Yes, and there's more that should be coming. What we do know is that we're now building on the data that we have. We know that the critically ill patients, we know that we're at least 34% represented in critical care. We're now getting data about deaths, and we still don't have data recorded of ethnicity on death certificates. So these are some of the things that we will be tackling centrally and must indeed happen.
That sort of information is surely needed critically if you're to prevent future deaths.
Yes, and for all communities, actually. This kind of highlights not just for BME populations, but for all of the population. If you don't have the data, then you can't solve the problem. And so there is something about not just having the data, but intelligently using it, because frankly, we know that BME populations are overrepresented when it comes to pneumonia, disease in some respects, 13% over the general population. And now we have a 34% critical illness in COVID-19 related critical care. So how do we use the data better that we have got? We need to start doing that straight away.
I mean, those numbers are so stark. Does the world of medicine have any idea why they're so stark?
Some ideas, but it's best not to start making things up. So we know that underlying health conditions such as asthma and heart disease, diabetes, BME populations will present at a higher level. We also know that outside of healthcare, there are socioeconomic factors reported by Michael Marmot in his report about socioeconomic conditions, but actually consultants, healthcare workers and nurses right across the scale of economics, some are paid very well and some are not. So this isn't just a simple correlation, and we do want to get to the bottom of a disease that really is quite frightening.
As you say, it is right across from well-paid consultants, but there are a number of very low-paid healthcare workers who, I think, up until now, will have felt that many people viewed them to be low-valued, that term low-skilled. Do you think this changes any of that?
I think it must. The low value, the hostility that BME people face, and they do day to day, the reality of the microaggressions we face, the staff who will report in our workforce race equality standard reports that they face more discrimination and harassment. These are realities, and we do want them recognised. We want the anxiety recognised for the whole population, but more so for BME staff who are on the front lines and scared that they won't go home. This is not acceptable.
So much more to talk about, but Joan Sadler, for now, thank you very much for talking to us. Thank you.